Hi everybody, I'm Adam Del Conte and I'm a medical director at Midwest Express Clinic, and this is Ask the Expert. It's February, and you may not know this, but February is classified as American Heart Month, which is a super important topic because technically everyone has one. So what we're going to talk about today, a couple different things. One is just the importance of awareness and prevention of heart disease, and another is that there are some differences in the presentation of one of the more acute or urgent heart issues, a heart attack. So probably the two most important things that we could talk about in terms of heart health would be the importance of prevention and recognizing when something truly acute and dangerous is happening. Not to be overly dramatic, but hypertension or high blood pressure is called the silent killer for a reason. Generally, the symptoms of high blood pressure don't exist until a decent amount of damage or problems have come from it. First off, have a good relationship with your healthcare provider and don't be shy about checking in for that annual visit or more frequently if any acute concerns come up. One very easy thing to do is to just get your own blood pressure monitor or cuff. They're quite affordable now, in the 30s-ish of dollars, and you can get them from any online retailer or at your local pharmacy. And a little robot sits in there and will measure things for you, keep a record. You can just check your pressure at home over the course of a couple weeks and bring those numbers into your provider for review. So what to do if our numbers are high? Let's say, the top numbers consistently over 120 or over 130, the bottom numbers consistently creeping above the 90s or into the hundreds. That's when it's time to take action. And one of the most effective things you can do is just dietary change and exercise. The things that everyone loves to hear a doctor say, because of course they didn't know that before they came into the office. Let's talk about what to look for if something acute is happening, if you have a known history of heart problems or a family history of heart problems. Important things to know is in both individuals, in men in general, but in women in particular, the signs of a heart attack can be more subtle or not quite that textbook or cliche picture that we think of. We can often see something as simple as just intense, persistent feelings of indigestion, pain that radiates up to your jaw, down the left arm, numbness or tingling in those same regions. All of these signs, from the cliche heart-clutching, chest-crushing pain to the more subtle, just increased indigestion, dizziness, feeling off, could be presentations of heart disease or heart attack in the right person. Obviously, the more history of heart disease or family issues of heart disease, the more suspicious we would be of the more subtle symptoms. But it is important to note that people with uncontrolled diabetes, and women in particular, may present with much more subtle or atypical symptoms. So I certainly don't want you to stress out and be worried about every little thing, but there are some important differences between people with pre-existing conditions and between men and women that are important to keep in mind. So thanks for watching this episode of Ask the Expert. For any of your urgent care or primary care needs, please swing by into Midwest Express Clinic. We service a great portion of Northwest Indiana, and if you feel like taking a road trip, we've got clinics in Chicago and the surrounding suburbs.